And I want to start with Michael. Michael, can you introduce yourself to everyone? Tell them how to say and spell your first and last name, and let them know where you're from.
My name is Michael Standiford. I'm originally from Jeffersonville, Indiana. Currently living in Miami, Florida, Homestead, Florida, which is about 15 minutes from Miami. Would you like me to spell my name?
Yes, please, so everyone gets that right.
Okay, it's Michael. Standiford is Standiford, just like the airport used to be there in Louisville.
Absolutely. All right, Michael, first, can you kind of tell us a bit about your journey? And I know that's a big question because there's a lot to it, but could you kind of take us from the beginning? You sent us this beautiful to thank the ER team. And so I really wanted people to understand your story, why you were at the ER so much. So if you wouldn't mind taking that away.
So when would you like me to start? From the beginning? I mean,
if you're willing to start at the beginning, yeah.
Okay. Well, like I said, I was born in Southern Indiana, and I was born the day after my mother's 16th birthday, and her side of the family struggled with mental health really bad, and my father's side of the family struggled with addiction. It was I was kind of at a disadvantage. A couple months after I was born, the environment we lived in was so bad that the state of Indiana felt it was necessary to take us both, because she was a minor, and put us into foster care. But a lady from Sellersburg Elementary School adopted us both. So we were able to live in the same home for a while. And I guess around 5 years old, my mom met who I call today my dad. And he raised us and gave us a roof over our head and everything, and changed our living environment. My sister was born when I was 8 years old, and I didn't realize it. But I don't know if you've heard of resentments, but that was probably my first resentment, because she took all the attention from me, and my mother gave her all the attention at that point. And, there was some other really strange stuff that happened when I was a kid. One of the reasons we got took out of that environment is I got left in a house for a weekend by myself. And I remember being too young to reach the lights, and all I wanted to do is just turn the lights on, but I was stuck in the dark. And somehow the police got involved, and that's what brought the attention to my mother and the environment that we were lived in. And that's what got us into foster care. So I guess, that kind of rattled around in my subconscious. And around the age of 13 is when I started experimenting with drugs and alcohol. And I didn't realize it at the time, but now, looking back, I was using drugs and alcohol to cope, because I just had so many issues going on. The strange events that happened when I was little, the resentments and stuff. And there was really no moderate stage. As soon as I discovered that drugs and alcohol could make me feel different, I took off, and I used it every chance I could get. And it got kind of bad, because it got to the point where I was drinking and drugging constantly, just to be honest with you. And drugs and alcohol became my higher power. It ran my life. It determined when I ate, when I slept, when I worked, if I slept, when I ate, it made the decisions for everything that I did. And around 2017 is when I encountered meth. And meth really took me in a downward spiral really quick. I'm sure you've heard of meth-induced paranoid psychosis, but almost immediately after I started doing meth, I started experiencing meth-induced paranoid psychosis. And that's what got me in and out of your hospital so much, because not only the emergency room, but the psych ward as well. Because honestly, I thought I was being chased by these fake or real people. I still don't know, which they was, but, I was having visions that these, shadow people, or whatever you want to call them, had me surrounded. And I don't know if they were getting ready to kill me or what they were getting ready to do, but it put me in an extreme psychosis to where I just really didn't know what to do. And a lot of times I would become suicidal, or I would just be completely out of my mind. And one of the things that would happen when I got into that paranoid psychosis was I would always think it was a good idea to eat all my drugs. And that's why I kept coming to the hospital overdosing, because I thought if these fake or real people, I still don't know what they are, if they got me, then I would have to hide the evidence. And evidence, if I threw it in the trash, they were going to find it there. If I flushed it, they got a toilet trap. So the only logical conclusion I could come up with at the time was to eat it. And there were several occasions where I would eat 3 or 4 8 balls, and that's a lot of drugs. That's enough meth to keep you up for 2 months. And I would eat that in one bite, thinking that that is the logical solution. But little did I know that, well, I guess, I don't know if I knew or not, but, more than one time it killed me. It just completely killed me. The one time I came into your hospital, I leaned on the front counter and I told the lady, I said, I just ate a lot of drugs and I'm dying. And that's the last thing I remember. I remember seeing her jump up. And then a few days later, she had told me that I'd been on a ventilator. And what had saved me was I didn't have any ID on me. So they couldn't call any immediate family to come up there and identify my body. So, and I guess, at some point, God just figured he wasn't done with me yet. So he blew his breath in. And now, fortunately, I'm here. And 2 weeks before that is when I got shot in the stomach. I got shot in the stomach on approximately 20th and Broadway. I was out, really late at night in an area of town that I shouldn't have been in, doing things I shouldn't have been doing. And two guys jumped out and they robbed me. And after they robbed me, they turned around and took about 4 steps away. And then one of them turned around and he shot me in the stomach. And of course, the emergency room department saved me again there. So, that after that happened, my cousin used to deal with prescription pills real bad. And he had moved here to Florida in Boca Raton and got into a program, and he got 4 or 5 years of sobriety. Now he's working in the recovery industry. So after them events happened, my family was like, look, you're living a pretty reckless life. Let's try something different. So that's when they moved me here to Florida and got me into recovery here, and the change of environment and, just, I guess you would call it a spiritual awakening. I'm not sure what you would call it, but it's like when I got here, I just decided, the life I was living was not the life that I was designed to live. It's not going to get me anywhere except dead, and so I had to make a lot of tough decisions and take a lot of steps to turn that around. But by the grace of God, I'm not using and drinking and drugging no more. So.
And you're going to school, right?
Yes, ma'am. I'm currently enrolled in Kaiser University. I'm working on my bachelor's in psychology and I'm making an A. So everything is going really, really good. And that's the reason why I wanted to reach out to you guys, because, at any given time, I would have gave up on me. There was times where I was there once a month overdosing. And then there was times I was there twice a week overdosing. And then I was there every couple days I was overdosing, and they never gave up. And I'll never forget this one lady. I wish I knew her name, but I went in there and ma'am, I literally had vomit in my hair. I had threw up and fell into the vomit. And the lady still was rubbing my head and she said, Michael, it's going to be okay. It's going to be okay. And, I was so high that literally just her care brought me down, because I was on the verge of death. I've been dead before. I know what it feels like when I'm dying, and I was dying. But her care saved me. It saved me because I felt enough peace that I feel like it lowered my blood pressure and it lowered my heart rate, and it brought me back to a level where I was in, like, I could live again, and without that, I don't think that's even part of her job description. Like, her job description is to provide medical, assistance to whatever's going on. It's not take time out and just really care for a person. And that really means it saved my life. I don't know if I wish I knew the lady's name. I had really thought over and over, man, I need to send her some roses. I need to do something, but I had no idea, what her even name was. But it was such a powerful experience. And that's what put me on the road to start thinking about, there's really good people out here. And I'd like to be a part of one of those really good people to help make a difference in people's life. And it's because of that staff there that made me want to do something different with my life.
Wow. Dr. Hecker, I do it because what is that like to hear his story and then hear him just so that for the ER staff?
It's wonderful to hear. Thank you for sharing it. We need to hear more of these stories because we often do catch people at that low point and try to instill some hope. And we have amazing nurses and doctors that
Yes, sir.
try to, share a vision of what coming out of this on the other side, basically. And so, it can be challenging to meet every patient with that bit of hope and compassion, but that's our job. That's what we want to do for all these
Yes,
patients.
sir.
Dr. Hecker, will you introduce yourself to everyone and spell your name, please, so they get that right?
Sure. Yes, I'm Martin Hecker. It's spelled Hueckeer, and I'm an academic ER doc with the UofL, and I work at the Jewish hospital as well, but full time at UofL Hospital.
When you hear Michael's story, and he gave us his backstory kind of about his childhood, is that something when we're talking about addiction, we're talking about drug use? Do we hear stories like that, background like that often?
Yes, definitely. So, there's a lot of research now on ACE, adverse childhood events, and experiences. So, many patients and people with addiction have problematic upbringing and go through a lot of trauma as children. And there's a really good book on it called Chasing the Scream that really, you use kind of drugs to cope. Children who have all those challenges growing up don't learn coping skills and turn to that. And and then the author of that book brings in treatment strategies that address those issues: social connection, getting into new environments. These are very effective treatments for addiction.
Michael, we have a couple of questions for you already. Paul Miles, he's with WHAS Radio. He wants to know what's been the most difficult part of the recovery process for you.
The most difficult part of the recovery process?
Yes.
Finding positive coping skills, because for so long, when things get hard for an alcoholic or an addict, we remember the immediate sense of ease and comfort that comes from just using. So finding new coping skills and new ways to deal with stress in a productive manner, that's been the most difficult.
Candace Clift from WDRB is asking you, Michael, what did your letter tell the hospital staff, that nice note that you sent?
I just, I reminded them of a few times that I had been in there, and I just really wanted to thank them for the great job and the caring and the peace that they provided while I was there, because that was a really dark time in my life, and I didn't really have a whole lot good going on. But every time I went there, they just reminded me that there's good people in this world, and there's people that really care. Even when I didn't care about myself, they cared about me. I had given up, but they never did. And thank God for that.
Absolutely. Dr. Hecker, a couple of questions for you. How has COVID-19 affected the level of drug overdoses you're seeing in the ER?
That's a great question. So, as many people know, overall volume has decreased throughout COVID-19, especially in the spring. But drug overdoses and visits for substance abuse and also psychiatric illness kind of went up. It varied by month, but we already published a couple papers about this because, people are under more stress. People cannot get to medication-assisted treatment or like medications for opioid use disorder. And so they're using illicit drugs. And so we've seen a lot of overdoses. And then we work with the coroner's office to collect data, and they have seen more overdose deaths during this time period. So it's very challenging to get people with addiction the treatment they need when we have these barriers. And there's been a lot of conversion to telehealth, which has been helpful. But a new paper in JAMA just showed that a lot of providers don't want to begin a new patient relationship via telehealth. They, patients who are already seeing these addiction specialists, they continue that with telehealth, but establishing a new relationship is kind of tough if you can't be face to face with someone.
Another question from the chat, and then David Mattingly has a question. But first, how common is it to see patients like Michael come into your emergency room so many times?
It's very common. In the emergency department, we don't have continuity of care. Like a primary care doctor sees the same person. And so our continuity involves folks who have really challenging, often social problems, maybe psychiatric and substance use. And we end up kind of loving these patients. We get to know them pretty well. Our patients are brand new to us, but hey, I see, Jim is here again. He's intoxicated tonight. We give him some coffee, get him a sandwich, give him some care. And so it is common. It's sad also because a better social environment for these folks could help them thrive more, out there in the world. And we don't want them to have to fall into our safety net. But we're, of course, accepting and work with our care managers to try to optimize their social situation.
David?
Okay, thank you, Dr. Hecker. I have a question for you and Mr. Standiford as well. Dr. Hecker, first to you. What trends are you seeing in the ER right now beyond just the elevated numbers of addiction cases coming in there? During this COVID-19 period, a lot of people are cut off from their support. I'm wondering, what are you seeing that is different about the overdose? What is different about the overdose patients that you're seeing right now compared to before COVID-19?
I mean, I'd say it's pretty similar. We are seeing people who, again, do have MOUD, we call it, medications for opioid use disorder, who are treated pretty well outpatient, but that treatment kind of falls apart. And so they end up back in the ED, off of their, path that they were going on that was controlled nicely with medications. And then, there isn't really an option like that for methamphetamine use disorder. So we see a lot of the same folks who are under the influence of meth or have meth addiction. But I think greater quantities, especially on weekends and when people can't get to the care they need. But this is something we've been dealing with really for probably a decade now. It goes back to House Bill 1 and pulling the opioid pills off the street. And then when meth started to surge a few years ago, COVID, has caused a lot of issues with how we deliver care and has limited us in a lot of ways. But unfortunately, this epidemic that was already going on of addiction has kind of continued that whole time.
Thank you. And Mr. Standiford, thank you for sharing your story with us today.
Yes, sir.
I'm curious, what is your biggest concern right now for someone who is addicted to drugs during COVID-19?
The biggest concern is the 12-step programs they're not open. Here in Miami, there's hardly any 12-step programs, NA or AA, to go to. It's all online, and online is good, but it's not the same as having, personal interaction and being around other like-minded people that are going through the same thing. That's really the biggest struggle with addicts right now is not being able to physically attend the 12-step programs.
Well, what's the solution to this? Is there one?
I mean, I guess, these type of meetings right here is probably the only solution. It's important to find a support group with all types of people, not just people from recovery, but, if you can get involved in some kind of church family, that's good. If you can get involved, with anybody that is not using drugs and alcohol, and just, people that are doing the things that you want to do, hang around those kind of people. Don't hang around the people. They say change people, places, and things, and that's very important. Everything must change. You can't do any of the same things that you used to do if you expect to, stay clean and sober.
My apologies for taking so much time, but one more question.
Yes,
Mr.
sir.
Standiford, what sort of conversations have you been having with addicts, and what are they saying to you about the difficulties they're having right now?
Again, the biggest problem is the 12-step programs, not being able to attend them. Anytime I talk to them, I just give them, of course, let them know how I did it. Personal experience is one of our biggest tools, is letting each other know, because there was a time where I didn't think it was possible to stay clean and sober for one day. So just being able to hear that, somebody's been sober for a couple years or even a couple months, because staying sober one day seems impossible to the addict that's still suffering. But once they hear that somebody else does it, it gives them hope.
Thank you.
Yes, sir.
Another question in our chat for you, Michael. What advice would you give to those who are currently battling addiction or in the same shoes that you were once in?
The biggest advice I could give is just never give up. Don't ever lose hope. There's always hope. Every day you wake up, you get a chance to make another decision, and hopefully it just boiled down to, I just got tired of living the way I was living. I got tired of that vicious cycle. It never seemed to end, and it was always getting worse. And I got tired of it. So I think that just admitting complete defeat is the only way to win this fight against drugs and alcohol. So that's definitely step one, is just to admit that you can't do it no more and that you need help.
And Michael, how old are you?
I'm 46.
All right.
Yeah, I spent 30 years in active addiction.
Wow.
30 years.
Wow. We're so glad you're doing so well now. It's incredible.
Thank you, ma'am.
Dr. Hecker, Paul Miles with HES Radio says Tom Miller with UofL Health spoke yesterday about the increase in gunshot patients. Can you speak to what you're seeing in the ER regarding this?
Sure, we are seeing a lot of gunshot patients. I haven't seen any recent numbers. I know we've broken some records in the past few years in Louisville as a city, but the summer is always a tough time. A lot of violence occurs in the summer. And so this was a very busy summer for penetrating trauma at UofL. We are seeing it, drop off somewhat now that the cold is coming in, and rainy, snowy days do help kind of prevent some violence. But no, it's been a big year. I think at the end of this month we'll see what the numbers look like. This could be the most gunshot deaths that we've had in Louisville in many decades.
If anyone on here wants to unmute and ask a question, you're welcome to.
Is there a copy of the letter that we can get a picture of, or is it hanging somewhere?
I can send you, I have it in my email, so I can send you that if Michael's okay with that.
Yes, ma'am, of course.
I will send that out to everyone when I send some pictures and B-roll as well. Michael, what's your message to Dr. Hecker?
My message is just, don't give up doing what you're doing, sir. I know you probably don't see a lot of cases where, people stop using and turn their life around, but now and again it does happen. And I'm living proof of that, what you guys did, it doesn't just help me, because it put me on a path to where I want to help other people too. And that's why I'm taking psychology, and that's why I'm pursuing a career in the addiction industry, because it gets to a point where addicts lose everything, especially hope. And when there's no hope, there's really nothing else. So I just want to be able to provide the hope to addicts and alcoholics that, we do recover. We do recover. We don't stay down. And it's just a choice. If you wake up and you make a choice that you don't want to live that way no more, you don't have to live that way no more. So, but it would have never been possible if your staff wouldn't have been so loving and caring. So my message is just please keep doing what you're doing.
Yes, thank you. It's so powerful, and we don't hear enough of these awesome stories and inspiring stories. And I will spread the word and share this session with everyone I work with, because again we see people whose surgeries don't work, or whose medications didn't work, and they come to us, and just seeing these messages of hope. I mean, you're nailing it there with how important that is, because someone in active addiction doesn't see the other side. They and I can try to describe that to them, but you really have to, a peer support specialist, somebody who has been through it, who they come to our ER and work with our patients. I mean, that's really what you need, is to see that hope.
Yes, sir.
And how long have you been sober now, Michael?
2 years.
2 years.
Yes, ma'am.
And I'm assuming there was a time when you never thought that was going to be possible.
I thought that was just going to be my life. I just thought that the person I was a drug addict and an alcoholic, and that was just the way it was going to end, because I didn't see any hope, and I didn't know if there was any way out. And it was too big for me. Addiction was just too big. There was no way that I could live with it, or I couldn't live without it. So I don't know, what happened, but one day something happened, and I just decided to make a different choice.
And do you have family with you in Florida?
My cousin lives here he lives in Boca, but most of my family's back in southern Indiana and Louisville, Kentucky. My Aunt Deb lives in Louisville, and my dad and my sister live in Jeffersonville.
What is their reaction to your turnaround?
They can't believe it, really. It's a night and day difference. My mom passed away in 2013 from cancer, and a lot of what I do is for her too, because I never did get to change my life while she was alive, but I know that she's watching now, and I know she's proud. So I just, I want to make her happy too.
What's your message to someone to say, go to the ER, get help when you need it, go get it. Don't just think they're not going to care about me. They're going to say whatever. What is your message to tell people, go to the ER and get help when you need it?
definitely go to ER and take advantage of all the things that's offered there at that hospital. Not just, you know, the emergency room, but there's the mental health unit too. That's very important because there's a lot of issues going on. It's the actual use of drugs and alcohol is probably the smallest part of it. You know, the inability to cope and, you know, the anxiety and the depression and all the stuff that goes along with it. That's really the biggest issue. We just, you know, as a drug addict and alcoholic, we get so used to coping with drugs and alcohol. We don't know that there's other methods out there, but there is other methods, and like medication can be a great help, you know, and, you know, the caring staff can be a great help, and the programs that they can refer you to from, you know, like the mental health unit, that are very effective tools, and, you know, we need to take advantage of. Nobody can stay clean and sober alone. You got to have help.
Absolutely. I'm not seeing any other questions in the chat. I'll give people a second if anyone needs to unmute to ask one. And I will ask Michael or Dr. Hecker, is there anything that we didn't talk about?
I mean, there are hundreds of things that we could talk about, but, you know, I think keeping the message simple and straightforward, a message of hope and patience, compassion, not giving up on people, envisioning a future where people come out on the other side of addiction, getting people connected to the resources they need. I did want to mention a rehab center called New Lease that's in town that I have no financial relationship with, but they amped up their COVID-19 testing. I know because we work with them on some research, and they were able to keep people in care in an aggressive outpatient management. So, you know, when COVID comes along, we find ways to still get people with addiction the care they need. When the next big challenge comes along as a society or in our state or city, we, you know, make adaptations and get people the care they need.
Thank you. Michael, one quick question. What year did you move to Florida?
I moved to Florida in 2018, right after I overdosed and came to UofL Hospital the last time. Like a few days after that, I moved to Florida. It was approximately June of 2018.
Excellent. Well, thank you, Michael. Thank you for sharing your story. This is going to help others, so we appreciate you so much. And please keep in touch with us. Let us know. You know, we want to know when you graduate, and when, you know, we want to know all about what you're doing so that we can keep passing that along to our team.
Sure. Thank you.
Thank you. And Dr. Hecker, thank you so much for taking the time to do this and for all that you and your team do every day.
Yes, thank you. Thank you, Michael.
Thank you, sir. It was a pleasure to meet you, everybody.
And media, I do have some pictures. Michael, if you have any other pictures you want to share, feel free to share those with us. But I have some pictures of Michael and some generic video of our ERs that you all can use, and I'll send you out the exact note that he sent. So thank you all so much. If you need anything else, just let me know. You all know how to get in touch with me. And as always, we appreciate you sharing stories like this with our community. So thank you, everybody.
Thank you.
Bye.